Welcome to this audio summary of the research article Use of Neurofilament Light Chain to Identify Structural Brain Diseases in Dogs. Introduction. Neurofilament light chain, NFL, is a critical protein found in neurons, providing structural stability for axons and regulating their diameter. When axonal damage occurs, NFL is released into the cerebrospinal fluid (CSF) in peripheral blood, making it a valuable biomarker for detecting neurodegenerative diseases. This study explores the diagnostic value of serum NFL concentrations in dogs with various intracranial diseases, including idiopathic epilepsy, i.e. meningoencephalitis of unknown etiology, MU, hydrocephalus, and brain tumors. Objectives. The primary objectives of this study were to evaluate serum NFL concentrations in dogs with structural brain diseases compared to healthy dogs and dogs with IE. Determine the diagnostic utility of serum NFL for distinguishing between structural brain diseases and IE. Assess the correlation between serum NFL concentrations and lesion sizes in dogs with MU and hydrocephalus. Background. Intracranial diseases in dogs, such as MU, hydrocephalus, and brain tumors, pose significant diagnostic challenges. Traditional diagnostic tools, including magnetic resonance imaging (MRI) and CSF analysis, are often expensive and invasive. Blood-based biomarkers like NFL offer a non-invasive, cost-effective alternative for diagnosing these conditions. Previous studies have shown that NFL concentrations increase in response to axonal damage, making it a promising marker for neurodegenerative diseases in both humans and animals. Materials and methods. Study design. This retrospective cohort study included dogs that visited the Neurology and Neurosurgery Service of Chungbuk National University between January 2014 and February 2022. The study groups comprised 37 healthy dogs presented for health examinations, 31 dogs diagnosed with IE, 45 dogs with MU, 20 dogs with hydrocephalus, 19 dogs with brain tumors. Inclusion criteria. Dogs were included based on their medical records, which documented signalment, physical and neurological examinations, laboratory test results, MRI findings, CSF analysis, infectious disease tests, and histopathologic features. Specific criteria for each condition included idiopathic epilepsy, i.e. chronic recurrent seizures with no abnormalities in neurological, MRI, hematologic, and biochemical examinations. MU, age, 6 months. Focal or multifocal neurological signs, T2 and fluid attenuated inversion recovery flare hyperintense lesions, CSF mononuclear pleocytosis, and exclusion of infectious diseases. Hydrocephalus, clinical features, exclusion of other encephalopathy causes, and specific imaging findings such as ventriculomegaly and periventricular edema. Brain tumor BD neurological signs, solitary regular-shaped lesions on MRI, and histopathologic confirmation. Serum collection and NFL measurement. Blood samples were collected in serum separator plane tubes from the jugular or peripheral venipuncture at diagnosis. Samples were centrifuged at room temperature at 2000 xg for 10 minutes and sera were stored at -80 degrees Celsius until analysis. Serum NFL concentrations were measured using single molecule array Simoa technology, with duplicate measurements and controls to ensure assay precision. MRI and lesion volume estimation. All dogs underwent brain MRI using 0.3 Tesla or 1.5 Tesla units. MRI sets included T1 weighted, T2 weighted, and flare images. Lesion volumes for MU and BD were measured using commercial image viewer software, and ventricle to brain height ratio, VBHR, was used for hydrocephalus lesion sizes. Statistical analysis. Data were analyzed using GraphPad software, with results presented as median and interquartile range. Non-parametric tests, including the Kruskal-Wallis and Mann-Whitney-U tests, were used to compare NFL concentrations. Receiver operating characteristic, ROC curves and Spearman's rank test were used to determine diagnostic utility and correlations between NFL concentrations and lesion sizes. Results. Study cohorts. The study included 152 dogs, 37 healthy, 31 with IE, 45 with MU, 20 with hydrocephalus, and 19 with brain tumors. Demographic characteristics such as age, body weight, and sex were recorded. Notably, dogs with BD were significantly older than other groups, and those with MU and hydrocephalus had lower body weights. Comparison of NFL concentrations. Serum NFL concentrations were significantly higher in dogs with structural brain diseases, MU, hydrocephalus, BD compared to healthy dogs and those with IE. Specifically, healthy dogs, median NFL concentration of 12.30 pgml. IE dogs, median NFL concentration of 14.90 pgml. MU dogs, median NFL concentration of 125 pgml. Hydrocephalus dogs, median NFL concentration of 58.35 pgml. BD dogs, median NFL concentration of 99.20 pgml. The differences were statistically significant, with MU dogs showing the highest concentrations among structural diseases. ROC curve analysis. ROC curve analysis demonstrated the diagnostic utility of serum NFL concentrations, structural diseases versus healthy dogs, AUC equals 0.931. Optimal cutoff equals 35.70 pgml. Sensitivity equals 83.33%, specificity equals 93.48%. Structural diseases versus IE, AUC equals 0.868. Optimal cutoff equals 27.10 pgml. Sensitivity equals 86.67%. Specificity equals 74.19%. Mu versus healthy dogs, AUC equals 0.982. Optimal cutoff equals 41.45 pg/ml. Sensitivity equals 88.89%. Specificity equals 97.30%. Mu versus IE, AUC equals 0.943. Optimal cutoff equals 62.05 pg/ml. Sensitivity equals 82.22%. Specificity equals 93.55%. Correlation with lesion size. Significant correlations were found between serum NFL concentrations and lesion sizes. Mu, correlation with lesion volume, R equals 0.429, P equals 0.01. Hydrocephalus, correlation with VBHR, R equals 0.563, P equals 0.01. BD, no significant correlation, R equals 0.013, P equals 0.96. Discussion. The study highlights the potential of serum NFL as a non-invasive biomarker for identifying structural brain diseases in dogs. Elevated NFL concentrations were observed in dogs with Mu, hydrocephalus, and BD compared to healthy dogs and those with IE. The strong correlations between NFL levels and lesion sizes in Mu and hydrocephalus further support its diagnostic value. Clinical implications. Serum NFL concentrations can help differentiate between structural brain diseases and IE, guiding the decision to perform advanced imaging techniques like MRI. This approach offers a practical and less invasive diagnostic tool for veterinary practitioners, improving the accuracy and efficiency of diagnosing intracranial diseases. Limitations and future directions. The study's limitations include small sample sizes for certain groups, lack of CSF NFL measurements, and heterogeneity within Mu and BD subtypes. Future research should address these limitations by including larger cohorts, evaluating CSF NFL levels, and exploring the role of NFL in monitoring treatment responses. Conclusion. The study underscores the potential of serum NFL as a practical biomarker for diagnosing structural brain diseases and predicting lesion sizes in dogs. Thank you for listening.